now, the government has introduced fresh, tighter measures as it seeks to prevent the importation of COVID-19 cases into the country. In a travel advisory, the Foreign Affairs Ministry asked the general public to either cancel or postpone all non-essential travels to countries with exceedingly high COVID-19 infection rates. Here's the head of our health desk, Fred Smith, with details of the measures.
Government says all travelers arriving in Ghana will have to self-isolate for 10 days, even if they test negative at the airport. For those arriving from COVID-19 hotspots, the advisory says they may even be subjected to repeat tests on the third day, even if they tested negative on the day of their arrival. All PCR test results from countries of departure will be taken through special verification to weed out fake results. And for those leaving Ghana, the advisory says only test results or certificates bearing trusted travel or biomass codes will be considered valid.
Now, Dr. Da Costa Abuaje is the Director of Risk Communication and Community Engagement of the National COVID-19 Response. He has been explaining this advisory.
It's really working.
Can you tell us which countries these increased numbers are coming from?
Let me be honest here. You see, I mean, I'm the one in charge of risk communication. Stigma and discrimination is actually something that I will not really want to, obviously. So I don't want to stigmatize any country. I don't want to. The only thing that I want to tell you is that we have the data of the countries that these cases are coming from, and we have put additional measures in place to make sure that we curtail the virus.
Dr. Abuaje, forgive me for interrupting, but this is a global health crisis. Ghanaians continue to travel to many, many countries. If there are countries where the PCR tests are unreliable, according to the Ghana Health Service, should you not be informing Ghanaians so that when they can make decisions about whether to travel to such places or not? For instance, if and you can confirm this for me if I'm inaccurate, but I understand that airlines have been briefed that the majority of the numbers that came in were from China. So if this is the case, should you not inform Ghanaians so that they can make decisions about whether or not to travel to China if it is likely that they are going to come back with a fake or a false negative result from there?
So now, you remember what I told you, we have put in place a system to check fake certificates. So we believe that this system that we put in place is going to help us. So I'm not going to mention any country, any country to stigmatize any country of this. We have issued travel
Dr. Abuaje,
advisors.
I don't know if this is stigmatizing the country. I mean, I really don't want to travel somewhere and come back and be quarantined for 7 days. I don't want that. Now, as a Ghanaian, should I not be informed that that is likely to happen to me if I travel to a particular place? Also, if we're trying to protect our borders.
So you can obviously do, there are various forms of doing it. You can actually categorize it under continents. Like you can say when traveling to Asia, you have to. But I have a problem mentioning names, and I don't think it conforms to my standard.